Good morning. My name is Vera Salzburn, and I'm a trained teacher in mindful self-compassion. And I would like to welcome you all into the space, and also thank you to Laura and all the organizers of this conference for having me to spend the next 5 minutes with you all, just in a mindful reflection and in a short meditation. And before we start our meditation, I would like to read a poem, and hopefully nobody here hates poetry, but I think you would like this one, that I think would be a good reminder to us, what is it like of being a human being? So the poem goes like this. If you can start the day without caffeine, if you can always be cheerful, ignoring aches and pains, if you can resist complaining and boring people with your troubles, if you can eat the same food every day and be grateful for it, if you can understand when your loved ones are too busy to give you any time, if you can take criticism without resentment, if you can conquer tension without medical help, if you can relax without alcohol, if you can sleep without the aid of drugs, then you are probably a dog. So it's a nice, humorous poem that just reminds us that being a human being involves lots of imperfections, and life is imperfect and we are imperfect, and that's just how it is. And perhaps today we can take a moment to begin to accept ourselves and our experiences just as they are. So I invite you to join me for this short meditation, for this soft landing meditation to help us ease into this day and into this conference. And I would like you to just sit comfortably, or if you wish, you can stand or lie down. And let's perhaps set an intention to bring our hearts and minds into this space and into this present moment. And if you wish, you can close your eyes fully or partially. Or you can just simply gaze down with a soft gaze. And let's begin by simply listening to the sounds in the room without pushing or pulling, just letting them come to you. And now in your mind's eye, finding your own body in the room. And perhaps welcoming yourself, greeting yourself with an inner smile. Perhaps imagining a smile inside your mouth, or lifting the corners of your eyes or mouth into a smile. Inclining your attention toward yourself, as you might toward a dear friend. And just for a moment, dropping your awareness into your body and feeling the sensations in your body right now. Perhaps there are some pleasant sensations or unpleasant. And just allowing them to be there just for this moment. And just remembering that you are not alone. And that uneasiness and discomfort is part of the human condition. And if there is discomfort, can you let your heart soften a little? Just to be a little more tender for you for just this moment. And perhaps offering yourself words of encouragement Like, it's okay. You can handle this. And finally, appreciating the effort and good intentions that brought you here, which is already an act of compassion and self-compassion. And gently opening your eyes. Okay, thank you. If you wish, you can just take nice few deep breaths to let go of any unnecessary tension and enjoy the rest of your day.
Good morning and happy Thursday. Before we begin, we would like to thank Vera for leading our mental wellness moment. This is a reminder of the importance of prioritizing our mental well-being, especially given the incredibly disturbing events that has currently happened in our nation and our state. I am Jennifer Morgan, and on behalf of the Board of Directors for Georgians for a Healthy Future, we would like to welcome you to Healthcare Unscrambled 2021. Georgians now more than ever need a unified voice, vision, and leadership to achieve a healthy future for all Georgians. This past year, GHF leaders, staff, partners, and volunteers worked together with consumers and communities to achieve a healthier, more equitable Georgia for all. Some of those accomplishments include GHF mobilized more than 5,000 Georgians to comment on the governor's detrimental health care waivers, demonstrating broad public support for affordable, comprehensive health insurance for all Georgians. GHF worked closely with elected officials from both political parties to pass protections against surprise medical billing, which will lower the cost of health care for over 2.5 million Georgians. These protections went into effect January 1st of this year and contributed to the passage of federal protections passed by Congress in December. And our last accomplishment to highlight this morning is that GHF handed the policy advocacy microphone to consumers by collecting and sharing dozens of consumer stories, holding focus groups with young people with mental health or substance use conditions, and also hosting listening sessions with Georgians with disabilities. These efforts supported consumers to speak directly to advocates and policymakers about their 2020 health experiences, which will also help inform health policy change. Our goal is to continue with the same momentum this year and also years to come. As you all may know, this is GHF's first virtual Healthcare Unscrambled event. We typically host a one-day in-person breakfast. However, this year, the event will be held over 3 days. So over the course of the next 3 sessions, our goal is to mobilize and build a plan to ensure all Georgians have equitable access to the quality, affordable health care they need to live healthy lives and contribute to the health of their communities. For our first session, Politics, Possibilities, and Policy, we will kick off with a discussion about how the U.S. and Georgia's health policy landscapes will be shaped by the results of our previous election, followed by a panel from some of our state legislators to discuss the outlook of the state budget and health-related legislation during this upcoming legislative session. Tomorrow, we will host a roundtable discussion to hear from Georgia consumers and families from across the state as they share their healthcare experiences, and we will also explore the inseparable nature of health from work, education, transportation, social connectedness, and other social determinants of health. As we know from direct or either indirect experiences, COVID-19 and its ongoing impact in our nation has revealed major gaps in our understanding of health equity and the needs of our consumers and communities. We will spend our last session on January 14th to examine these gaps and also offer a reimagining of the interconnectedness of mental health, racial equity, and our overall well-being, and also the role of health advocates in shepherding the necessary changes as we move forward in improving the health of all Georgians. We hope that you all be able to join us for all sessions. Next slide. GHF would like to thank all of our sponsors. We would like to thank Hemophilia of Georgia for their sponsorship and support of this session. While we recognize our other sponsors, we want to launch our first poll question of the session. These results will help inform the panel discussion and also allow everyone to learn about each other's priorities. Poll question number 1. Other than COVID-19 response or vaccination distribution, what is the top health issue that you hope federal and state decision makers take action on in 2021? Please provide your response. Next slide. Healthcare Unscrambled sponsors support GHF's year-round advocacy on behalf of Georgia consumers. If you enjoyed today's program but haven't given yet, we hope that you'll consider a donation to GHF today. Next slide. Two other notes before we begin this morning's discussion. GHF is currently hiring for 2 positions. Please consider joining our team or sharing with people you know who may be interested in either opportunity. You can find out more on our employment opportunities page. For this session, please keep your microphone muted. We would love to see you on video and interact with you on Facebook and Twitter using the hashtag #HCU2021. In today's Zoom room, we'll primarily rely on the poll and Q&A features. When you have questions for today's panelists, use the Q&A feature rather than the chat. The Q&A feature allows you to upvote and comment on questions so that we know what matters to you most. Before we introduce our moderator for the first panel, we would like to see the results from our poll. From the results, it appears that it looks like the top priorities are addressing racial health disparities, the high rate of uninsured, and also improve access to mental health and substance use services. Thank you so much for your response. So moving on to our first panel, I would like to introduce our moderator, Elise Blazingame. I would like to introduce our moderator, Elise Blazingame, a doctoral student in the School of Public and International Affairs at the University of Georgia. She will facilitate our discussion on how the results from the November election will impact federal and state health policy. Thank you. Over to you, Elise.
Thank you so much, Jennifer. It is truly a pleasure to be with all of you and with Georgians for a Healthy Future, an essential organization in our state, with some truly great panelists this morning. It is my privilege to introduce to you Sashiko Staples Miller and Emily Barson, our esteemed panelists who will guide us through the current healthcare policy landscape. Sashiko Staples Miller is the Director of Access to Care and Medicaid and of state and local campaigns for the American Cancer Society Cancer Action Network. She's responsible for managing and supporting their advocacy and engagement efforts related to Medicaid, health equity, health disparities, and HPV in all 50 states, as well as DC, Puerto Rico, and Guam. Sashiko also serves as the project director of Medicaid Covers US, which is the American Cancer Society's national public education project aimed at informing and promoting the value of Medicaid to individuals and families across the country. Emily Barson serves as the executive director of United States of Care, a nonpartisan, nonprofit organization with a mission to ensure that everyone has access to quality, affordable health care, regardless of their health status, social need, or income. During the Obama administration, Emily led the Office of Intergovernmental and External Affairs with the Department of Health and Human Services, where she was responsible for liaising with state, local, and tribal governments across the country, as well as the wide range of stakeholder groups touched by the department's work. Through that role, she developed strong relationships with leaders and influencers from both parties, as well as a nuanced understanding of the perspectives and interactions of all major players in the healthcare sector. Welcome to you both. I have some prepared questions here for both of you. I will ask each question and give you both a few minutes to respond. And then as time allows, we hope to also answer audience questions toward the end of the panel. So to our audience, please do pop your questions into the Q&A window, as Jennifer mentioned. So for our first question, given where we are at with the recent election results, and of course, an intense focus on federal politics in Washington right now, in broad strokes, what do the election results mean for health policy federally? And what do they mean for health policy in Georgia? And Sashiko, I will ask you to start us off.
Okay. Thanks and good morning, everyone. And what I would start by saying is that from a federal perspective, I think we are going to see a great deal of receptivity to many of the pressing issues of the day for organizations like Georgians for a Healthy Future and ACS CAN, and so many of us who are gathered here this morning for Healthcare Unscrambled. It's been a while since we've actually been able to have an audience and have meaningful dialogue with federal policymakers, especially at the executive branch. And I think there already has been. For any of you who've had the opportunity to interact with some of the members of the Biden transition team, I think you, like I know I did when I had some of my first interactions, found that it was refreshing, and that we could actually have an audience with federal policymakers, decision makers, who are genuinely interested in the issues confronting the patients that we serve, the consumers that we support, our constituents. And so that's what I'm most looking forward to at the federal level, is that there's an opportunity and going to be a platform through which we can have meaningful dialogue to come up with policy solutions looking forward, and then also to address a number of the challenges and barriers that have been erected over the past few years, in addition to those that have just been areas of concern when accessing care, affordability, the adequacy of coverage, et cetera, that we've been fighting for decades. So that's what I'm most looking forward to at the federal level. And then I think some of the challenges that we have faced, unfortunately, in the state of Georgia are going to continue for a while, because as you all know, the balance of power in the state of Georgia has not changed, has largely remained, the same. But I think that with the new opportunities and hopefully some new incentives being provided at the federal level, both at the executive branch, in the executive branch and at Congress, that there will be that much more incentive for Georgia policymakers to reevaluate, reassess some of the decisions that they have made, and then come up with some really innovative solutions for addressing healthcare needs of Georgians and people across the country in the years to come.
Great. Emily.
Great, thanks, good morning, and thanks for having me. you teed up this panel talking about the results of the election in November, but certainly as folks on this call know better than anyone, really the results of Tuesday's runoff for the 2 Senate seats in Georgia are decisive in some of the national implications. And when we talk about what the prospects are for health policy at the federal level, and with Reverend Warnock and John Ossoff's victories, the Senate, of course, will be tied 50-50 with Vice President-elect Kamala Harris serving as the tie-breaking vote. So meaning Democrats will have the smallest margin possible, and Democratic control of the 2 branches of Congress and the executive branch. But of course, with such a narrow margin, I think there's question about sort of what type of major legislation the Congress or the executive branch will pursue. I think it does mean that appointments by the new administration will presumably be in a position to be approved by the Senate in a way that might have been in question had that control not shifted. And hopefully less contentious, allowing the new administration to choose their leadership. The Democrats may choose to look at reconciliation as a way to pass legislation that could only require a majority vote rather than the 60 votes that's typically required for major legislation to pass. But again, of course, with a 50-50 split, that also implies holding together the full caucus. And we know that in this type of situation, centrists like Republican Susan Collins and Democrat Joe Manchin will have a really strong influence over the legislation or sort of what the agendas are that are taken up. And at UNICEF Care, one of our core principles was alluded to is building support and advocating for durable policies and really ones that are people-centered and can be supported by a majority of people. And that often means looking for bipartisan relationships and compromises. And so we expect to urge Congress to seek solutions with that type of broad support and really focused on people's needs and not looking solely at the partisan implications. I think we also will be interested to see what the administration takes up under their executive authority and things like waivers that may allow states to take on coverage options or look at different types of models that haven't been possible previously. And HHS and CMS can also strengthen mental health parity laws and enforcement through the Medicaid contracting. And so, I think there are certainly things within the authority of the new administration that may not require a 50-50 Senate to approve.
Yeah, so mentioning the waivers, we have a question about how that's going to play out here in Georgia. Before I get to that question, I just want to acknowledge that there are some great questions in the Q&A, and I see them, and we will get to those as we have time. So the question about the healthcare waivers. So in Georgia, the governor's healthcare waivers were approved last fall, right? And since then, there's been discussion of whether a Biden administration could take back the state waiver approval, maybe renegotiate some of the specifics of the waiver or take other actions. So the question is, how might the incoming administration act on these waivers? As a point of reference, these are to be implemented beginning in July of this year with partial Medicaid expansion. And we'll start with Emily and then go to Sashiko.
Yeah, no, this is obviously, I'm sure, top of mind for so many folks, and I'm seeing that also in the Q&A. But I think to be implemented, which is expected to be in beginning of July of this year, the legislature would need to provide state general funds for that implementation. I think the Biden administration will have some options to revisit approved waivers, but it's not an immediate process. These things, as you know, the waiver consideration and approval took time from the Trump administration, and that is sort of by definition a long and deliberate process. The goal of waivers and the statute that this was approved under in the ACA is to promote coverage. And certainly there's a question as to whether the approved waiver moves towards that stated goal. And I think built into these waivers is a requirement around evaluation and understanding the impacts and the outcomes. And so certainly at least the administration will have levers and will have an ability to carefully watch the consequences on folks' coverage. But whether what that means for the immediate access to care as that were to take place later this year, I think remains to be seen.
Yeah, and just I echo what Emily mentioned. I think there's been a lot of discussion from advocates about urging the Biden administration to rescind waivers, and I think that while that is something that is been raised in multiple conversations with transition team officials and others, I think it's a little bit concerning because that would set a dangerous precedent for what could happen with a new administration. And as I've had some conversations with some of the folks who Emily had the pleasure of working with prior to the election and after the election, I think there's been a lot of consideration given to rescinding waivers, but that could really cause much longer term harms as we see transitions from one administration to the next. But what we absolutely have, as Emily mentioned, is that lever with the standard terms and conditions and the approval and the evaluation that is a component of every single waiver approval, and the Biden administration being able to be much more aggressive in making certain that states that have waivers that have been approved are following those, and then they can come back and they can actually strengthen some of those. The other thing that I would mention that a lot of us and you all I'm sure have been talking about is that a lot of the guidance that has been issued to states through state Medicaid directors has been just that. It's been guidance. And day one, much of that guidance can be rescinded. And there have been robust discussions with transition team officials about being able to do that. And a great example of that is the work requirements and the block grants. And while we are hopeful that the courts will continue to rule in our favor with respect to work requirements, there's still a lot that can be undone around those two guidances that had been issued by the Trump administration that did not come with a legislative mandate or anything like that. So those are two in particular, and there's a lot of other guidances that have been issued that will be untangled and unpacked and rolled back over the course of, I would say, the first several months of the Biden administration.
Looking at how, Sashiko, you mentioned earlier about the fact that while there's huge changes at the federal level in terms of composition, political party control, not so much at the state level for Georgia. And so some of our other considerations around these waivers are, what are the implications of the state elections on the appropriation for the waiver match in Georgia? And what is the likelihood that the Georgia General Assembly might reconsider the waiver at some point or move to support a full Medicaid expansion? And we'll start with Sashiko and then go back to Emily. Thanks.
Yeah, I think that this is, as I'm sitting in the state of Georgia, and while my work is national, I have the privilege of working with many of you here in the state. And I think that one of the most powerful levers that we have as state advocates is when there are policies that have been introduced that then require the legislature to come back and provide the budget authority or the spending authority to go forward with those. And so I think that there is, even though we are going to be doing a lot of our work virtually, I think the power of our voice, our collective voice in raising concerns about the cost implications of this partial expansion, of eligibility up to 100% of the federal poverty level. When you really think about the actual benefit to the number of people who are currently uninsured, who are being who have been devastated by COVID and the downturn in the economy, when you weigh the cost benefit, I think there's a very strong case to be made to Georgia policymakers that the dollars that would be associated with the appropriation, the spending authority that would need to be provided to do so little for so few, it's not justified, and that we could do so much more by actually maximizing the opportunity to draw down the 90% match by giving more people access to coverage, which is so critical in the midst of a pandemic, in the midst of an economic downturn that is just devastating for rural communities, especially who are already under-resourced, as well as so many people of color and other, population groups who are only seeing COVID exacerbate, the systemic disparities that they have been facing for generations. And so I think that there is a very strong case and argument for us to make to policymakers. And my sincere hope is that with this Congress looking the way that it does. And with the Biden administration being sworn in on the 20th, that they can move very quickly to develop some additional carrots or incentives for states like Georgia to reevaluate and reconsider some of these waivers that have yet to be implemented, or some states actually implementing some of the bad policies, and I'll call them that because that's what they are, some of the bad policies that they have, whether it's because of the public health emergency declaration or just them understanding that things like work requirements are not good, that they will be disincentived. The incentive will not be there, and that there'll be some financial incentive for them to actually go up to 138% of FPL, and making sure that there's a robust healthcare.gov marketplace available to people and those types of things.
I certainly don't have insight to add on the Georgia legislative dynamics. I'm, sitting here in Washington, D.C., but, just to pick up on your last comments and, some of the recommendations that we've made to the transition team and to Congress is, considering doing just that and making an incentive to late adopting expanding states to go back to the 100% match that was available to the states that adopted the expansion when it was first available under the ACA, looking at, at ways to encourage states. I think, certainly as time has gone on, it is a smaller number of holdout states with the sort of political badge of honor of not expanding, but the evidence of the benefits for people and the the stability and the access that it offers continues to grow from states with all different types of demographics and composition, and we've even seen traditionally red states, of which I don't know that we can put Georgia in that category anymore, adopting Medicaid expansion by popular ballot initiatives, and really seeing that people who are, voting for expanding access to healthcare from both parties, from all different types of walks of life. And so, I think that's been a really interesting piece over the last few years of really voters and people taking that issue into their own hands.
We're going to get into the bigger, not bigger, but of equal importance is the fact that all of this change is happening in the context of a major pandemic. And so we will shift over to how COVID is intersecting with these big changes. But there's a really well put question in the chat that relates to what both of you have just said, which is, there's a focus on the Biden administration being able to come in, make some big changes, having now the Senate and the House to pass some major legislation, or at least to keep legislation in place regarding the ACA. So this question is, so we're obviously excited about all of that, right? The change in direction on national health care, but if we do not pay attention to the large chunk of the country that believed in the direction for healthcare over the past 4 years, that supported those endeavors or that perspective on how Medicaid programs should be or should not be formulated, how the ACA should or should not, provide different services in the healthcare realm, we will not be building bridges. So how do we build bridges in healthcare going forward? And I think that's particularly salient given that, after the ACA, we have experienced just continuous backlash against the different aspects of that policy. There's been a lot of infighting about that policy. So how do we build bridges moving forward with the context that there's going to be a lot of ability to make some wide sweeping changes at the federal level?
I'll jump in if that's okay.
Sure.
No, I think that's a great question. And I think it's really, in a lot of ways, core to why, we started United States of Care and why, we think that there is an opportunity to really step back from what you described, this dynamic of the last decade plus around the ACA and everything really being just such a political issue in football, and really allowing us to focus our recommendations, our policies on people's needs and on the outcomes that we think people are looking for out of the healthcare system, that they can afford the care that they need, that they have dependable healthcare coverage as life changes, and that people can access the care they need when and how they need it, in a system that they can navigate. I think, as you alluded to, and there is no health conversation in 2020 or 2021 that doesn't really have the specter of COVID looming over it. And, we can talk about all these waivers that may have been conceived before we were in the midst of a public health emergency. But, I think the reality is that COVID has and will continue to shape the needs and the policies that we see going forward. And, I think is almost cliche to say by now, but really has both underscored and worsened a lot of the inequities within the healthcare system. And I think that seems to be very clear. And to the extent that we can be looking at evidence and looking at, offering real examples from what people are experiencing in the healthcare system and doing the listening that is required to understand their experiences. And, I think one way to build that bridge is really looking at the opportunity to build a better, more equitable healthcare system in the wake of COVID, and not looking at those as two separate tracks of efforts or of work.
Yeah, and I would just, what I would want to add or build on that Emily mentioned is, despite the criticism of the ACA, there are clearly a number of critical components, elements of that legislation, of that law, that everyone across this country, whether it is, revealed to us through polling, whether it is revealed to us through, policymakers on the right or on the left, describing, there are critical components that were patient protections that were part of that law, that bill, that every single one of us agree has to be preserved. And I think that is the bridge on which we walk as we are, in the midst of this transition. Things like, no pre-existing conditions, things like basic anti-discrimination policies, people wanting to have access to affordable coverage, comprehensive benefits, those types of things. Those are just some core elements of the ACA on which we all agree, and that has been a constant. And I think it's those things that we build on, but we absolutely, as Emily said, have to look at where we are as a nation, the country as a global community, and better understand the impact that that COVID has had on us, but then also how it really has exacerbated so many of the longstanding disparities and challenges that people face, especially as it simply relates to a person being able to get from their place of residence to seek medical attention, whether it is acute or whether it is primary. None of us want to have to travel for hours to simply see a primary care physician. None of us want to have to finally get there and find that we have to wait for hours. And, in the case of cancer patients who obviously we represent, we know that the challenges that cancer patients are facing more and more, even before COVID, related to simply getting to the oncology care that they need, the challenges have been growing. And so, it's only unfortunately been made worse over the past year. But I think that these are the kinds of things that have been revealed to us that provide incredible opportunity for us to come together, no matter which side of the aisle you might say you're on, and come up with some meaningful evidence-based solutions that are going to address so many of these issues.
Well, I appreciate the optimism from both of you, and I really appreciate the question because it's true, right? We need to build policies that make sense for everybody and that are going to bring the greatest number along with us to make them durable, as I think you mentioned earlier. So getting into COVID, it is the most pressing issue facing the country rather, in Georgia, of course. So what has the incoming Biden administration said about their plans to address the pandemic at this point? What do we know that their focus is going to be on? And we'll start with you, Sashiko, and then go over to Emily.
We've, as I mentioned, we've had several of us, and I think one of the calls in particular, Emily was on with me and some of my colleagues. They are laser focused on, response. And I'd say response first and vaccination second. And they are being very clear about that and trying to understand from a number of different groups like ours and like, yours, what the most pressing issues are for your constituents. And, the one thing that I've really been excited and encouraged by is the thoughtfulness in which the transition team have been trying to, and this is a conversation that we had actually, I think, before the first vaccine was being administered, but that they are really being thoughtful about addressing the anything that might lead to a person being hesitant about receiving the vaccine. And they're doing so with a very targeted and I think strategic focus on communities. And without question, making certain that people who represent, the Black community, the African American community, they have leaders from within that are talking about the value and the importance of vaccination. And that we are taking advantage of the opportunity to utilize current infrastructure in place to track and to report so that we are being really smart, thoughtful, and efficient about the vaccine being administered. And so that's what's encouraging at the federal level with this, well, from the Biden administration that will be, in office here in several days. And then I think the challenges that states have been facing all across this country as the vaccine has been distributed and trying to make sure that it is getting to local communities. I think those challenges are great. I know there've been a lot of bumps. And I think that there will be greater support and coordination from the Biden administration and CDC and other federal agencies to state departments of health, as well as county and local departments of health, to make sure that as many people are able to access the vaccine as possible. And those were just a few of the things that, in the conversation the conversations that we've had that have me encouraged and make me feel a little bit more confident that we'll move a little bit more swiftly to win the fight against COVID.
Great. And we are getting toward the end. So Emily, any brief comments that you'd like to add to that?
I think that was great. And I think, the thing that we'll see really immediately and have already seen is a change in tone. And I think, rebuilding confidence in our institutions and our public health leadership is going to be a long-term issue, but I think seeing that modeled from the president-elect, who has said that immediately he'll ask everyone in the United States to wear a mask for 100 days in his administration and other, really broad changes in tone, I think will just begin to navigate that change to a more robust and coordinated response effort.
It's encouraging to hear. So we have actually unintentionally answered a couple of these questions, which is great through the conversation. But another one, and I think this is really salient as we think about the fact that COVID has really dominated our discussion and our focus in the healthcare sphere, and things like mental health and mental wellness, which had been gathering steam, maybe hadn't been receiving as much attention this year. So this question is, though we understand the state budget had to be cut due to COVID-19, this is in the last session in Georgia, how do you suggest we as mental health advocates implore legislators to direct more funding toward community mental health resources in light of this being a mental health pandemic as well, especially in suburban and rural areas? And we'll start with you, Sashiko, if that's okay.
Yeah, I think one of the most powerful voices that we need to amplify is that of local providers, because they're the ones who are seeing, who have been seeing for many years now, the toll that mental health, the lack of mental health and behavioral health services is having on the healthcare system. And without question, I completely and totally agree with what the commenter, the person who wrote the question, said, is that this is equally a public health pandemic as well as an economic crisis, but a mental health crisis. Because even for people who had not traditionally needed to seek substance use disorder, mental health, behavioral health services, all of the pressures that people are now feeling has led to an increased number of people needing services, and that all that pressure is being felt by the providers, the local community providers, who are simply trying to handle pandemic response, and now they've got so many other issues that they're facing. And so I think what's going to really be critical is for us to use whatever means necessary to harness their voices, to capture their voices, and to be able to connect those folks with their local elected officials and with legislative leadership in the state. Because I really think that there are a lot of policymakers who simply do not understand. They don't operate in this world that we live in. And they don't have intimate knowledge of just how taxing the need for mental health, behavioral health services is on our healthcare system that's already fragile. We're already dealing with rural hospitals that are closing and provider facilities and offices that are shuttering, and that was happening before January 2020. And so I think it's really going to be important for us to bring those policymakers, bring it to their attention in a way. And that's kind of the beauty of maybe one of the good things about COVID is that I think it's a little bit easier to get some of those local community providers to have a virtual audience with the policymaker, because they don't actually have to get in their cars and drive to Atlanta. But they can do some things a little bit more local. But I think that's going to be really critical, increasing the knowledge and understanding of policymakers to the toll that demand for these services has and will continue to have on the system, and our inability to respond appropriately. And that can go a long way in helping make the case for increased investment in these services, and doing a better job of integrating care and doing better care coordination, and making certain that just as much as we and providers are focusing on physical health, that we're equally focusing on mental health. And I know that parity is a really big issue for Georgians for a Healthy Future, and so many of you who are on the call. And I think that this is just one small step that we could take.
Thank you. Emily, anything you'd like to add?
I would, certainly agree with everything that you said. I think, the question referenced the necessary cuts in the state budget, and I think it really underscores the need for more federal resources in future response packages, and making sure that explicitly includes mental health services when you're talking about either efforts to minimize cost sharing or, looking at the standard of care for COVID-19 patients, or even during vaccination, including, mental health screens, and just looking at where are those touch points that we can try to get ahead of this, because this is certainly going to be one of the really long tails of this pandemic.
And I cannot believe it, but we are already at the end of our first panel. Thank you so much to both of you for sharing your insights with us and helping us to illuminate some of these issues at the federal and the state level. And we have so much ahead of us, and there's so much up in the air right now. And I know that Georgians for a Healthy Future and all the advocates in Georgia will continue to benefit from your insights. So thank you very much to both of you. So please join me in thanking our amazing panelists in the chat. We really appreciate you taking the time to talk with us today. In a moment, you will see a second poll pop up on your screen. So please take a moment to respond to the poll and get ready for our second panel with legislators. And I'm going to kick it back over to Laura Colbert. Thanks, everyone.
Thank you, Elise. And thank you to Shashiko and Emily. It was really great to have all three of you here with us this morning. It just a lot of information and knowledge. I think I could hear them talk about the election and the implications and all of that for another hour or so. But we wanted to move along and get to our legislative panel. Hopefully you all are answering this second poll that's up in front of you about Georgia's decision makers will address a number of critical health issues this year. What issues do you think have been overlooked and most require attention in 2021? So you've got a couple of options there. Levi, if we have a number of responses, maybe we can see some early results on that. And it looks like this audience has picked Medicaid expansion by at least a 2 times margin, but also access to affordable mental health and substance use services, as well as school-based health and wraparound services. Those are kind of our top 3 answers for the really critical and overlooked issues for this year. So thank you all for answering that poll. We really appreciate it. And please continue to drop your questions and answers in the Q&A. And remember that you can thumbs up questions that you really want to see answered, so we know they are of interest to all of you. At this point, I want to introduce our second panel of the morning. We have Representative Sharon Cooper and Representative Jasmine Clark joining us this morning. Representative Cooper represents District 43 in the State House, which is the Cobb and Marietta areas. This will be her 24th year in the General Assembly since being elected in 1997. And over that time, many of you all know that she's become one of the biggest advocates for healthcare in the state, and she has chaired the House Health and Human Services Committee for over a decade. Most recently, she has sponsored or led bills that include youth vaping, protecting tenant rights in rental properties, extending postpartum Medicaid coverage from 2 to 6 months, making shackling of pregnant women in prisons illegal, and making life-saving drugs more available to patients without forcing the use of less effective drugs first. We certainly consider Chairman Cooper a friend of GHF and Georgia families, and we're very grateful to have her here this morning. We also have Representative Jasmine Clark. She is beginning her second biennial term at the Capitol, so she is a fresh new face, or relatively new face at this point. She represents District 108 in the Lilburn and Mountain Park areas of Gwinnett.
Can you really hear me? Is it because they're going to be?
We can hear you, Representative Cooper.
Sorry.
No problem. Representative Clark has a PhD in microbiology and molecular genetics from Emory University. She now teaches at Emory's Nell Hodgson Woodruff School of Nursing. And she was the 2020 co-chair of the Georgia Future Caucus, which focuses on issues that impact millennials as well as future generations. And she currently sits on the Budget, Fiscal Affairs Oversight, Higher Education, and Interstate Cooperation committees. And we are very grateful to have Representative Clark with us this morning as well. So good morning to both of you.
Good morning.
Good morning. And Jasmine, I'm sorry I interrupted your introduction.
Oh, no. It's okay.
Okay.
Thank you both. And thank you both for the early morning. We know we called you guys, everyone, all of the panel in early. So we really appreciate that. We will start with the, kind of topic of the times, which is COVID-19. As both of you know, the COVID-19 pandemic is at its worst levels, both here in Georgia and across the country. The General Assembly still plans to convene in person with testing and safety procedures in place for this year. Can you tell us a little bit about what you think session is going to look like this year? Do you think it'll be a full-length session? What issues and themes do you think are going to come up during the spring?
You want me to go first?
Go ahead.
Okay. We are going to convene Monday, but it is not decided yet, I think, whether we're going to convene and then recess, whether we'll stay in a week and recess or what. It depends on the COVID numbers. And I don't think that decision has been made yet. I think they're looking at what's happening. And I'm sorry, we're having computer problems here at the Capitol, of course. So really don't know about how it's going to function. We will still be spread out into the chamber and up in the balcony and over into the rules room. Thank goodness they do have new voting machines for people that are not on the floor to vote, so that we do not have to do the roll call, which means we can move faster. As far as what's going to happen, everybody's interested in the budget. I don't think that there will probably be any new additions to the budget. We are conservative. It's why we've come through this as well as we did, and why we came through the recession it started in 2008 as well as we did. And we have been holding very well, but depending on what happens with this wave, and if there's more closings and if it goes on longer and, there's more hospitalizations and we have to put more money into covering our hospitals and things that are not covered by the feds. Like, for instance, we are spending millions of dollars staffing hospitals that can't find staff to take care of patients, or nursing homes that don't have staff, and we're having to do that through an agency and pay for it, and we've literally spent millions. So as the state, but we've got to have people taken care of. So I think there's going to be a real wary look at the budget about starting anything new, just trying to hold. Of course, the first thing we would do is that if we felt like we had some extra money, would look at how it needs to go to our schools, because, by the Constitution, that is one of the things that we are required to do, is to educate the children of Georgia. So really, it's going to be a wait and see on the budget. I got here in time to hear you talk about mental health. Of course, that's my background, and we have already been talking about it. The commission that was established by law a couple of years ago by Representative Tanner is getting ready to present their first report. And I think we will be looking very closely at that. I've already talked to the speaker to see what comes out of that report that we think we can move legislatively to try to make changes to more adequately take care of our citizens that are mentally ill. And that is definitely an increased problem thanks to COVID. I don't know how anybody can come through without experiencing some degree of a little bit of depression. Maybe not clinical depression where you would say they need to be on medications or see a physician, but just the isolation and all is enough to make anybody a little depressed. This is my background. When somebody says, what do we do to have to tell people? I think there's a bigger understanding among legislators about mental health issues than people think. I have a mentally ill sister. I taught psychiatric nursing. I wrote 2 textbooks on psychiatric nursing. It's always been an issue of mine. I just think, like the rest of the country, it has been such an overwhelming, huge, gigantic problem that sometimes people have been afraid. And, people will say, well, how do you tell somebody's really depressed? Or how do you really know they're mentally ill? Because it's not like somebody having appendicitis where you can go in and you can get the blood work back and you can tell that the white counts off the levels and, they hurt when you punch a certain area. And I think that, and then some, prejudice toward it have been what has kept a lot of things happening in the past. But it is certainly, I think, coming to the forefront. It is more acceptable. Like I say, we've had the commission going because we recognized that we needed to look at this and we needed to work on it. So I can reassure everybody that we are going to start that this session. So those are my two things. It's the budget. And I guess the other thing is we did get approval for Medicaid expansion. It's not what everybody wanted, but one of, I think, our biggest movements will be try to get that program up and activated and as many people on it as we can get on it as quickly as possible going forward. So a lot of time will be spent on getting that done.
Thank you, Representative Cooper. Representative Clark, what would you like to add?
Representative Cooper really outlined what the policies will be for when we return. I know we're coming in on Monday. We have to get sworn in on the second Monday of January by per the Georgia State Constitution. So we will be there, although it will probably be very different than in years past. Honestly, I've only been sworn in once. And last time it was this, big affair and everyone was in the gallery. And, I do not think that we will have, or we will not have that type of atmosphere. Unfortunately, this time we will each have one guest and we will get sworn in groups in order to limit the number of people that are in one space at one time. I am very excited that we will not have to do roll call votes this time around if we are doing, because that was brutal. But what I will say is other things that I'm really looking forward to are the fact that we do have access to testing multiple times a week. And I do think that that will be helpful. And I wish that that was something that honestly could be available to more people, even outside of the Capitol, to try to get a hold on COVID-19. As far as things that I look forward to in this legislative session, I think that this COVID-19 pandemic has definitely shown a huge light on the fact that we still have a lot of work to do, and when it comes to healthcare and making sure that people have access to healthcare. And we also have it really shown a light on the healthcare disparities. And so I am hopeful that we will use this opportunity to address some of the healthcare disparities that have been exacerbated by the COVID-19 pandemic. I also think that we are going to, we have the Medicaid waivers, and I know that it's going to cover some people, but I would also like to see us really revisit ways to cover even more people. I think right now, the number, before we were going through that application process and things like that, the number of people who weren't covered was, or that fell into the coverage gap, I will say, was hovering around 500,000. But now with COVID-19, you've had unemployment, and a lot of people's health insurance was tied to their employment. And so I believe our uninsured rates are, when everything comes out in the wash, it's going to have increased dramatically because of the unemployment rates. And so I don't think that we can just ignore that is happening. And so I do hope that we will visit some of the options that we have to make sure that we are ensuring as many people as possible, because the truth is a pandemic is, so healthcare is expensive already. Healthcare during a pandemic is even more expensive, and we're going to need those resources. We need to make sure that we have adequate PPE in our state. We need to make sure that as we go through the vaccine distribution, that people are not financially pushed out of getting access to the vaccine, which means that I would love to see our state offer free vaccination as much as possible to make sure that enough people get it that we can actually get toward the goal of herd immunity when it comes to using the vaccine for those purposes. And education, making sure that we're educating people on the importance of getting vaccinated. And, just there's just so many things that we will need to address in this legislative session. And so, I focus mainly on healthcare because this is a healthcare panel, but I do think there are a lot of things. There's a lot of things that we were working on before, such as HIV prevention and eradication. Those things are still there. Preventative care, those things are still there. Stopping the closure of hospitals, through, different means, those things are still there. That was happening before the pandemic. They're still happening now. So I hope to see that in the next legislative session, along with all of the other things that we're going to have to deal with in the upcoming session.
Thank you both. Those are really great opening thoughts, and we have a number of really great questions in the Q&A. So there's a really robust conversation happening, and I want to go ahead and ask folks to give us a few extra minutes after the 10 o'clock hour. I think this conversation is going to go over just a little bit to the 10:05 mark, and my motion censored lights just went out, which I knew they would do. So apologies for that, but. While we're still on COVID, this question came up in the chat box as well, or in the Q&A box, but also we had kind of talked about this ahead of time. The pandemic has really spotlighted the value of a robust and prepared public health system. As COVID came on, it was pretty clear that, through no fault of their own, the Georgia Department of Public Health was just under-resourced, stretched thin. Our county departments of public health very much in the same shape. What lessons has the legislature kind of learned from this pandemic about Georgia's public health system? How might that materialize during the session? Will we see some extra investments there? What do you guys think that will look like?
Well, we have a major stock now of protective equipment, which we didn't have before, but we have a major stock. And of course, we passed a bill for the nursing homes last session because they were so totally unprepared that they had to make sure that they had a stock on their own, not to just think somebody was going to come in and do everything for them, but to help us out and be prepared. I think hospitals have looked at their emergency plans and all. So I think we're much better off because of that. One of the problems that we have, you can call it a problem or plus, with local control, even though we give money to public health departments all over the state from here in Georgia and out of the state budget, we don't run those. Each of our 59 counties that has, a board of public health, they have their own board and they make their decision and they add to their funding. And some of our public health departments are really great. And frankly, some of them are not doing everything that we really would like them to do in helping us see patients. It's like in maternal mortality issue and all. And it is a problem. I'm not sure what the solution is, but it is a communications, and Dr. Toomey has worked hard to try to work with state directors to open up those line of communications to try to get everybody working on the same page, and hopefully, they will see the value in doing that. But there are some public health departments that still go their own way, and that can be a problem.
Yes, I would definitely agree with that. I have been meeting with my public health director all throughout the summer and the fall, and just got off a call with her yesterday, the partners call, where we all meet and we just kind of discuss what's going on in the GNR public health system. And I think that they are doing the best that they can with what they have. And I do applaud their efforts on, trying their best to get vaccines into as many arms as possible. But one of the things I think that kind of bothered me a little bit is, as I was on that call, one of the things that kept coming up was, we can't do testing and vaccine distribution simultaneously because we just don't have the resources. And when you're dealing with a pandemic, I think it's really important that we have both, and both need to be up and running as robustly as possible. But I understand that when you're working with a limited budget and you have to use the resources that are available to you, and not just budget, it's not just about money, it's about people. You need people to test. You need people to give vaccines. A random person on the street can't just say, hey, I'll poke people in the arm with a syringe. Like, you've got to have, qualified people to vaccinate. And so I just worry that with the budget that we will have to address in the upcoming session, while we are not expecting to have to do any further cuts. Even if we remain flat, that means that the cuts that we previously had to do, we had no choice. We're still going to be feeling the effects of those cuts. And so I do hope that, with the pandemic still here, and now with a variant strain in our state that is more contagious, and therefore we're going to possibly be dealing with overwhelming our healthcare system even more than it is already. It's already at surge capacity. It's already busting at the seams. And now we have a variant strain. I really hope that we can at least find some way to support the Department of Public Health a little bit more, so that we can make sure that we have testing capacity, vaccine distribution capacity, and all the resources that are necessary. But I also agree that we also need all of the individual public health departments to kind of get on the same page about priorities and what we need to do to get in front of the pandemic. But also understanding that the public health, this pandemic is just one thing that they're dealing with. When we're not in a pandemic, they're still dealing with other things, HIV, TB, other, surveillance, and all these other things that they were already having to do. The flu, the flu is also here. We're not seeing as many cases, which is a good thing, of the flu, but there are people still getting the flu in 2020 and 2021. So our health departments are still having to deal with the regular things along with the pandemic. And so I hope maybe at least in this first round of the budget, we can find some wiggle room to make sure that they are supported, so that they can continue to support the community.
Jasmine, I want to just step in here and say, you're such a researcher with wonderful educational background in your degrees, and I highly respect that. But as somebody who worked in public health, only briefly, I really didn't want to do that as a career, but I think this is one time when in a crisis, you deal with the most pressing problem. And I think testing has been overrated, and especially now that as we get the vaccine. And one of the things that we found on the state level with contact tracing on this one, doing it the way that we did in the 1900s, it just doesn't work with this. It spread so fast and all, and the contact tracing used up a lot of people's help, and we're short. And so I think as we get more vaccine, that the priority should be, and I'm speaking for myself, not to Dr. Toomey or our public health for Georgia, but my thing would be is to get the vaccines out as quickly as possible. And you were really right about education. One of the problems we were having is people are not taking the vaccines. Now, that's for several reasons. I hate the internet and all these, conspiracy theories. And I hate the fact that it's become politicized through the campaigns. And then there are people who just are anti-vacciners, and the others who just say, okay, I'm not going to take it right now. I'll wait and see you take it and let's see if, you know, how it affects you. And we are running at a real low number. The other thing is we probably have vaccinated not 100,000, but probably 200,000 people. But what's not happening is when they get their injection, their information is not being put into our system that shows who's gotten vaccines, into grits. It's called, like the food you eat. And that is a real problem. The other day, the first of the week, Northside Hospital had given several thousand shots. They had put 7 people into grits, 7. One of the other healthcare systems had given over 1,200. They put 1 person into grits. So it appears that people, you know, that we're not getting it out. Walgreens and CVS, the federal program with them to go into our nursing homes, they're dragging their feet. Instead of going out, you know, every day to a different nursing home, they're saying, okay, well, we'll do 2 this week and 2 next week. And I know public health here is pushing everybody to get stuff into grits too. And I know when hospitals are dealing with sick people, you know, here again, the priority is take care of sick people and all. So this is a real learning experience for all our departments. And when we get through, it's sort of like going to war and battle. And after a battle is over, when we finally get through this, we need to have a lot of the people that worked in this sit down and let's see what we did right and what we did wrong and what we need to do to change it going forward so we don't repeat our mistakes. And I'm going to be pushing for that kind of a review process. And I've already run it past the downstairs at the governor's, and there is real positive feedback to doing that. But after we get through the pandemic, and our response is to try to be as positive as possible to encourage as many Georgians to take the vaccine as possible. Sorry, didn't mean to get on my bandwagon, but I'm dealing with this every day, so it's just
Yeah, no, and I completely agree.
Georgians to be safe.
I completely agree with you, and I don't want to belabor because I know we have other questions to address. But I just want to say that I think the issue with our contact tracing and testing was that we started contact tracing way too late. You cannot start contact tracing months after a pandemic virus has already ravaged through the community. And so I will agree that the contact tracing part was woefully inadequate. But you know, I definitely agree with the last thing that you said. Everyone, after this is all over, we need to come together, because if we ever have to deal with anything like this again, we need to be much better prepared for it.
Thank you both. That was a really meaty discussion, and I'm very pleased to hear that the state is interested in kind of evaluating itself after this. I know approximately 107 people on the call today would be interested in being a part of that and hearing the results. We would, of course, certainly find that valuable, I think, from a health advocacy perspective. And I think there are, you know, many options for, you know, the legislature to find some extra resources to really invest in our public health system moving forward, so that it's strong and has the infrastructure needed for future pandemics. Earlier, Representative Clark, you referred to some of the really distressing racial disparities that COVID-19 has not caused, but certainly spotlighted. You know, many of these of similar disparities have been seen across chronic health conditions for a very long time, as well as the social determinants of health. So we see, you know, higher rates of poverty, lower education attainment levels among communities of color as opposed to white Georgians. Where do both of you see opportunities for addressing these kinds of disparities in the 2021 session? You know, does that appear in the budget, in legislation? And we will have a follow-up question on rural health. And of course, those two things intersect because we know our rural communities include communities of color. So
If you don't
Representative
mind.
Clark, do you want to
Yeah.
start? Yes,
I'll say, if you
please.
don't mind, I'll jump in here. One of the things that I think is really important to understand is that the healthcare disparities that we see did not just happen overnight. This is something that's been happening for decades, probably longer than I've been alive. And so it's not something that can just be fixed with a flip of a switch. This is something that we'll have to really take a deep dive into why there are so many different disparities and how to address them. But that does not mean, when you see a problem and it feels daunting, sometimes it feels like it's too big to address or too big to even try to address. But the point is, we still have to try. And so I do think that we have to continue to do the research. And yes, I am partial to research because I think that it's really important. I do think that we have to do the research to figure out the why so that we can come up with viable solutions to these problems. I absolutely applaud the maternal mortality study committee that they had in the previous session that did say, they did a lot of research and a lot of work was put into that to say that one of the reasons why we are dealing with such disparities when it comes to maternal mortality is because of access to healthcare. And so we need to expand Medicaid to postpartum mothers so that we can make sure that they're still seeing a doctor even after the baby is born. We only got 6 months of that. I know that the committee report said that a year would be better. And so I hope that there is political will to expand that to a year. But that's just one thing, because while that does address the fact that Georgia just has a really high maternal mortality rate, it did not necessarily address the fact that within that statistic, African-American women are dying at a higher rate. I'll never forget the phone call I had with my director of public health here in the GNR system that said that 1 out of 82 African-American babies will not live past the first month of life. It was something that I probably did not hear whatever was the next 5 minutes of that call, because it hit me like a bag of, I couldn't believe it. And so we have addressed maternal mortality. I would also like for us to address infant mortality and the disparities that we see when it comes to infant mortality as well in our state. Again, we're dealing with a flat budget. And so I understand, I'm new to this when it comes to, the budget process. And so I know that Chairman Cooper can offer a lot more insight on those types of things, because she's just been doing this longer and she's probably seen it all. But I just hope that there's room to at least address these things, because to me, when it comes to life and health, I really think that is worth it to at least look into ways that we can, things that we can put into the budget to save lives and to protect health and to make sure that we have a healthier Georgia.
Jasmine is really right. We didn't get where we are on healthcare disparities overnight. This is an ongoing, and Jasmine, it's been going on long before you were born.
Right.
And I'm older, and before I was born too, in the South. I think that I tend to we don't have a program that says, what we're a commission on racial disparities on health. And so people sometimes have to look at how we're going about it without really talking about it. I mean, one of the reasons I was so adamant to get extended postpartum care for new mothers, just one of the many reasons, and I wanted a year, but 6 months is what I got in the budget, and I'll take that and come back and beg for more. is that one of the reasons that we often lose babies are because of pregnancies being too close together. And one of the things about extending it out 6 months is mothers now have time, if we can get them to go back in, because Jasmine, that's a problem too. We have trouble getting our mothers to go back, and that's on all white, African-American, Hispanic, and all of them, getting them to go back to their postpartum visit, the one that they had, is to talk about birth control and birth spacing, so that they have an opportunity to get on birth control, and and discuss it with the obstetrician about why it's so important. And I mean, and really, if we could get people to space their pregnancies out to 18 months to 2 years, even better apart, I think you would see a drop. It's the same way. And one of the problems that when we talk about mental health that I didn't bring up is we are the 8th largest state in the country. We have been a state that has, I mean, if you go to Boston, there are probably more medical schools in a 5-block radius in Boston than we have in our whole state in Georgia. And only in the last few years, I helped get the osteopathic medical school here and change the rules so they could come. Have we expanded it? And we don't have healthcare workers that, they all tended to look like me, not like you. And yet Morehouse is doing a wonderful job. Mercer's working on rural health. We are trying, but it takes so long to produce doctors. So we'll begin to see the changes, but we're working on it, but it's a slow process. It's one of the problems we're going to have with any mental health initiative. We do not have mental health professionals across this state. It's almost, if maybe not as bad as our physicians. We do not have psychologists. We do not have psychiatrists. I mean, people are not going into those fields. And I'm not sure how to approach that yet. You can't just turn anybody loose working with somebody that's mentally ill without a good educational background. But it's something that we're going to have to work on. So I think that we're working on these issues from the periphery. And if more of us, as we talk down here, like you, and one of the nice things, I always feel like I can talk to you, and I hope you feel like you can talk to me. We don't always agree on everything, but and as we can think about this and find ways, even in tight budget times, that we can address and try to work on these issues. But it's often behind the scenes and peripheral, and it looks like we're not doing anything. But I can tell you that it concerns me. And anytime I can do something to try to help, I'm going to, try to push for that. It's just like the shackling of women. I mean, I don't deal with prisons. And it wasn't until a very sweet lady who, highly educated, a nurse who had been to prison and lost a baby because she was shackled, approached me at our biennial, 2 years ago and said, you might be able to help me. And could you help Representative Dreyer and your party? And I became aware of it. So I don't know. Sometimes you feel like there's so many things hitting you could just drown in it, and you just try to pick out 10 things and work on them. And but I know that we are trying to work on this. We just have a lot of work to do, and one step at a time. I'm on the rural committee. I've been all over this state. I've got the broken windshields on my car to show I've been in rural Georgia's on dirt roads and everywhere else. It seems like every time I go, I get a new windshield on my car. But the closing of hospitals, it's really terrible, but some hospitals are not going to make it. It takes about 45,000 people to support a hospital, a full service hospital. And we've got counties where you have a county and 3 counties around it, and the population in those 4 counties don't come up anywhere near to 45,000 people. And they literally cannot sustain a hospital. It is not something that is just for our state. It's happening all over in states that grew and were agricultural based in the Midwest, where they grew a lot of wheat and that kind of products. And people are moving to the suburbs and leaving the older people behind that need more care. You know, I fight our CON laws all the time because in many ways they keep us coming up with some new and innovative ideas for people can at least get emergency care and then get, you know, evaluated and move on in those areas. I'm not doing away with them totally, but they do need to be where we can have some flexibility at times. So I'm sorry, you just got on is near and dear to my heart, and that's patient care. I'm sorry. I'm just really concerned about the patients in Georgia.
This is a really great conversation, and Representative, as you said, there's always 100 or 1,000 things to get to and ask about and have the discussion on, and there's only so much time, which is unfortunately our situation this morning. So I do want to move us along. I want to go back a little bit to some threads from mental health, from rural health, from workforce. So, you know, the Behavioral Health Reform and Innovation Commission has been meeting throughout 2020, and the subcommittees have been doing just a lot of really great work. I've attended several of those meetings, and the commission heard recommendations from several of their subcommittees in November. They included adopting state parity policies, which would help, you know, with insurance coverage to make more equitable coverage for mental health and substance use. It included collecting data about Georgia's behavioral health workforce so we better understood who's there and who's not, expanding community-based and school-based health services, including through, you know, peer supports and, you know, non-physician providers. And there was some discussion as well about expanding health coverage more completely for the state as well. So through a Medicaid expansion or otherwise. So can you guys talk about kind of what pieces of the commission's recommendations do you think the legislature will pick up this year? And we do need to keep these answers relatively brief.
Okay.
If I can jump in really quick, my answer is very brief. And that is that I do see that people are at least thinking about the parity policies and reducing some of that red tape in order to increase access to mental health care in Georgia. And I hope to see that we do address parity in our state. I think that is one very, in my opinion, again, and maybe I'm just oversimplifying it, I do think that is one simple way to really, increase access to care for a lot of people. As a person who teaches anatomy and physiology, our brain and our mental health is connected to the rest of our body, and I feel like it should be treated as such. And so, I do hope to see that in this upcoming session.
Well, I joke about having scars from some of my fights I've been in down here, Jasmine, and dealing with insurance just to get it where patients didn't have to fail twice on medications.
Right.
Really serious illness. I've got the scars to prove it. Parity would be a major step forward with dealing with the insurance people are really a challenge, but it's not one that we can't try to take on. I don't think we'll see an expansion of Medicaid because we're in such a tight budget. There are going to be more people just eligible for it anyway, because of the layoffs and being unemployed. So I think the answer would be, and I don't have any connection to downstairs or anything like that, but the answer would be probably, let's see how this works, and see how many people we can get on what we have before there's an expansion. That is just my gut level feeling that there wouldn't be an expansion of that. And what was the other one? I'm trying to be short, that from the commission.
Community-based health services and non-physician providers. Yes.
It may be a really good way. It has helped with drug addiction. Putting, with new mothers that have just delivered that were on drugs. We've had great, and in the emergency room with that. That certainly might be a way. And, the governor has these things that in the technical systems where you can go, they're highly needed skills that we don't have for people in Georgia, like being welders, and you can go to a technical program and not pay tuition. I got nursing assistants, certified nursing assistants. That was put on this year because we need them in nursing homes so badly, well-trained nursing assistants. So it may be, and even on breastfeeding, a clinical specialist in breastfeeding. We even have a program like that that's graduated its first ones to be a real specialist in helping mothers that have real medical problems with breastfeeding and all. So it may be that working with the technical system of Georgia, there may be some kind of a peer, first entry people that could work with the mentally ill that could get a lesser type of education that we might be able to provide it free through. This is all done through a part of the HOPE. So it's something to look at and talk to the technical schools about and to look what other states do. And I'm open to doing that and being people in the community. When anytime people from your community are the ones reaching out to you, it is better because people are more comfortable with it. And if there's one place people need to feel comfortable, that is if they are having mental problems. They don't need me coming down from Atlanta and saying, let me help you. But when a person from their community that they've either heard about or looks like them or knows the same kind of places they do can help them, that's a real plus. So I'm for community-based.
Yes, we would agree. We think that results in some of the best health outcomes. It's really community-based services. I want to jump back to two things that have come up across the conversation today. And one of those, of course, is the governor's waivers. There's one waiver that will partially expand Medicaid. It's anticipated it would cover about 50,000 folks out of 500,000 who would be covered under a fuller Medicaid expansion. To start, I believe that that's actually the full number in the waiver application. But also the second proposal would separate Georgia from healthcare.gov and make it harder for consumers to shop for comprehensive plans. So I want to, given that that COVID-19 has really prompted thousands of job losses across the state, that those folks without employment would not qualify for the Medicaid program. Is there any chance the legislature will revisit these proposals given the context of COVID-19 and the greater need for coverage? And then I'm going to also tie in the budget. Is there an opportunity to raise some funds and invest in healthcare with an increased tobacco tax or other revenue raising options?
Oh, you're just really getting to the point, aren't you?
Yeah, and we have about 4 minutes to wrap up, so I hope you guys can cover those
two
giant things.
I would vote for $1 increase in tobacco taxes. I mean, I'm a nurse. I've seen people. I don't think there's any appetite for it. I don't know why it never, comes up, but I would love for to do that. I don't see us, because the waivers take so long to get and they have to be approved by the feds and all this kind of thing. I have no idea if there's a point to revisit. I think that if anything, they might have to try to adapt within whatever wiggle room they have within the waiver. And I can check on that. It's just not something I can give you an answer for because nobody's asked me that yet.
Yeah, that's a really good question. I am not sure what wiggle room we do have, but I will say that I do have a little bit of concerns that the pathways waiver that will go into effect in July does have those qualifying activities. And I think now with the pandemic and the fact that there are a lot of people who have lost their employment. I just worry about that, the qualifying activities, particularly the work requirements. And I'm so sorry, my dog is whining in the background. She wants to be in the Zoom too. But yes, so I do worry about that particular and I will say this, as a Democrat, I do think that the Democrats will at least put Medicaid expansion back on the table as far as, submitting a bill. I do not know that it will go anywhere, but I do think that we're in a position where if we have an opportunity to cover more, we should at least try. So that doesn't mean it goes anywhere, but that doesn't mean we won't put it back out there on the table. But to Chairman Cooper's point, the waivers haven't even been implemented yet, so we don't know what's going to happen. But I do not know that we have the luxury of waiting to wait and see with a pandemic ravaging through our communities.
Yeah, it's certainly an urgent issue. Well, thank you both so much for being here with us this morning. We really appreciate you being so generous with your time and your expertise. Thank you both to Chairwoman Cooper as well as Representative Clark. Thank you and good luck in session. Stay safe and stay healthy.
Thank you for having us, and thank you
Yes.
for all the groups that work with our children and our people across our state. You know, y'all are on the front line and your efforts are really important. And thank you so much for doing that.
Absolutely. Thank you. I echo everything Chairman Cooper just said.
Thank you both.
Take care.
Take care to you both as well. And with that, I will turn it back over to GHF's board chair, Jennifer Morgan, to close us out for this morning. Thank you all for hanging with us for just a couple extra minutes.
All right, very great, a very good discussion. Thank you all for joining us today. We hope that you enjoyed our first session of Healthcare Unscrambled for 2021, and that you were able to gain some additional insight as to what legislators are planning to tackle in the year ahead, and also some of the emerging health policy issues that was shared by our subject matter experts on the panel. We would like to thank our panelists and moderators for both panels. Next slide. Again, we would like to thank Hemophilia of Georgia for their support of this session. And also, in addition to our other generous event sponsors. Next slide. Next slide. If you enjoyed this session, please consider a donation to support GHF's work. We are especially grateful to our monthly donors who give a little bit each month. GHF is in it for the long haul, and so are our monthly donors. Next slide. Please join us for our next 2 Healthcare Unscrambled sessions tomorrow and next Thursday, January 14th. Both will start at 8:30 a.m. If you want to participate in the mental wellness moment, please join us at 8:25 a.m. Both of those sessions will include virtual breakout discussions, so you'll be able to interact with your fellow attendees and discuss what you've learned. Hope to see you there. Enjoy the rest of your day. Thank you.